This does not lift up on the head. It simply rests the head on this so that the weight of the head is not on the cervical spine, which we suspect might be injured. Make sense? So we've got to measure this to make sure it fits in a way that doesn't hyperextend him, or in which case he can't do this. Now this is not going to restrict his movement, but it's going to remind him not to move. And the primary purpose, again, is to reduce the weight of the head on the spine. All right, so this comes in different sizes. This comes in like, this can be sized. First thing you want to do is flip this over. This is the chin strap, okay? It's going to feel like you're going to break it, but you're not, so just flip it over, okay? Now we've got to measure him. So we're going to do it today with this KED. This is called the Kendrick extrication device. That's the seated SMR. We're also going to do it when our patient's lying on the floor, supine SMR, when we log roll them onto a backboard. So we're going to apply this either from the sitting position or a supine position. So the first thing I'm going to do, I'm going to sit my patient up, sit up a 1, 2, 3, making sure he's sitting up straight so that I get a good measurement. Then just relax your shoulders, okay? I'll have somebody holding his cervical spine, which is going to be Louise. Have they met you yet? You've been here, right? Mm-hmm. Okay, all right. You guys know Randy. Okay, all right. Now I'm going to measure. I want to know, since this is taking the weight of the head off of the shoulders, I want to know, once you have your hands up, there you go, the bottom of his mandible. The distance from the bottom of his mandible to this trapezius muscle. This is where it's going to, the C-collar is going to rest on the shoulder right here and support the mandible. So I need to know the difference between, the distance between here and here. I'm going to do that using my fingers. I'm going to take my fingers and lay my fingers parallel to the ground or perpendicular to the spine. I'm going to measure the distance from here to the bottom of his jaw. And I think that for me is about 3 fingers, just like that. I've got this on the trapezius. It's parallel to the ground. And I think the distance is right there to the bottom of his jaw. If I had 4, it would be too much. If I put 4 fingers in there, it's going to be too far. Now you can't transpose fingers. So I can't go, oh, it's 3 fingers, give me 3 fingers on this. My 3 fingers are different from your 3 fingers. Okay? So the distance there is 3 fingers. Now I'm going to take those 3 fingers, and I want the distance between this black line and the bottom here that's going to rest on his shoulder. That's got to be 3 of my fingers between my 2 index fingers there. See that black line? And the bottom of this, the black line, and the bottom of this. Okay? So I'm going to take, the way you adjust it is pull these 2 tabs out, these 2 blue tabs out, and then these 2 blue tabs out. So pull both of those out, and then you can see it changes. The distance between here and here changes, right? Okay? So you got 4 things to pull out. These 2 tabs and these 2 tabs. And then this thing will shift. So I want to take my 3 fingers and put on the bottom, and I want the black line to be right where my little finger is. No more, no less. Right from here to here. 3 fingers. Right there. Right? From the black line to the bottom of where it's going to sit on the shoulders. 3 fingers. My 3 fingers. Good? Right? See that? From this black line to the bottom of the C-collar. Then I'm going to lock it in. They're all locked in now. This should fit him now if I've measured correctly. So now, to apply it, I'm going to apply it from the front. See this little circle here? This needs to be in the middle of his chin. It also needs to be in line with this little circle here. These 2 circles need to be in line with center of his nose, center of his chin, those 2 circles, sternum, down to his umbilicus. So this midline here, that's what these need to be lined up with. So I'm going to place it, looking at him from the front, place it just like this. Here's the center circle, right under the middle of his chin. Okay? Going down here, and this should be right the center of his abdomen, all the way down to his umbilicus. That's where I want it, right there, underneath that mandible, just like that. Then I'm going to simply, from the front, wrap it around like this, and Velcro it. And you can see there's Velcro on the side. There's also a little bit of Velcro right here if it wraps around so far. Okay? From the back, now I need to evaluate this. It's on the trapezius here. I want to make sure that it's not pinching an ear. I want to make sure that it's under his mandible. Want to make sure he can still swallow and breathe. Can you open your mouth and stick out your tongue? Can you breathe? It's uncomfortable, I know, but is that hurting you or pinching you anywhere?
Not at this time.
Okay. Now from the back, it may not look centered from the back. I don't care. It doesn't matter about from the back. What matters is the front being under the mandible and resting on the shoulders. Make sense? This is a C collar. Okay. Any questions on that? That's going to be part of this skill. Okay. So allow me now to show you the skill. We'll show you how to apply this to a supine person when we do that skill, I think, maybe next week or whenever it's on the schedule. But this is the C collar. That's what it's for. Any questions on that?
If you have a patient with altered mental status, would you still be able to use that if you suspected their spinal injuries, like you're trying to
Absolutely.
convince them?
And that would probably be a good reason that you need to do it, because you're not getting an accurate history from him or her in terms of where their injuries are. Depending, based on the mechanism and based on your exam assessment, what's the matter?
I was drunk, so just like.
Oh, yeah. And you have to deal with it exactly like that. And so Luis is going to come up here and try to continually remind him not to move his head. Okay? So, yeah. All right, so let's do this. So first thing I'm going to do, well, let me show you the pieces of this first. This is a KD, looks like a straight jacket. I think I need another strap, man.